How's it going, guys? Medium difficulty question, pathology, step 1, internal medicine, 2 CK, 6-year-old woman, brought to emergency by her husband, 20 years, CI hypertension, current medications, lisinopril, atorvastatin, aspirin. They live on a farm. Serum studies show calcium normal 9.5 should be 8.4 to 10.2. Sodium normal 137 should be 135 to 145. Potassium normal 4 should be 3.5 to 5. Chloride normal 104 should be 95 to 105. Bicarbonate low 21 should be 22 to 28. Question wants to know mostly the diagnosis. And then we have a bunch of mud piles diagnoses here. We have a very vague vignette, not much to go by. But when you look at the answers, you say, okay, mud piles, which is the mnemonic for high anion metabolic acidosis. So methanol, uremia, DKA, fenformin, some obscure drug you don't need to know, iron slash isoniazid, lactic acidosis, ethylene glycol, which is antifreeze, salicylates, which is aspirin. So those are high anion metabolic acidosis. So the way you calculate anion is you're going to take bicarbonate and chloride, you add them together, you take that number, which in this case is 125, and you subtract it from sodium, which would give us 12. Normal anion gap is 8 to 12, elevated is 13 or greater. So we say, okay, we have a normal anion gap metabolic acidosis. So we look at the answer choices. We can eliminate ethylene glycol because we know that that's part of mud piles. We can eliminate lactic acidosis because it's also part of mud piles. Salicylates is fucking wrong because that's the S in mud piles. So we're left with Crohn and RTA, and you look at the vignette and you say, well, clearly it's not fucking Crohn, so we're left with RTA, which is how the USMLE assesses renal tubular acidosis. They're going to give you a pretty vague vignette, and you're just going to calculate that it's a normal anion gap. You eliminate the mud piles, and you're left with renal tubular acidosis. This is what NBME/USMLE will do. They do not give a fuck about 1, 2, 4, the different mechanisms that students get hysterical about. I'm not talking about bullshit Qbank questions, okay? So your take home is that when you get a question on USMLE where a bunch of the answer choices, you identify them as mud piles, you want to calculate the anion gap as part of the question, and then you can eliminate to get to RTA as the answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. Appreciate your time. That's it.